Did you know that 1 in 10 people in the United States have diabetes, and 30% of these are unaware that they are diabetic? 1 out of 3 adults have prediabetes, and the incidence of diabetes has doubled over the past 30 years, which is most likely associated with increasing rates of obesity and decreasing levels of physical activity. Type 1 diabetes is generally diagnosed in children and teenagers and occurs when the pancreas fails to produce insulin. Type 2 diabetes is the most common form of diabetes and is generally related to risk factors such as obesity and sedentary lifestyle. Type 2 diabetes occurs when the pancreas either makes inadequate levels of insulin or the body fails to recognize and use the insulin that is produced. This results in high blood sugar levels in the blood. Common symptoms can include excessive hunger or thirst, frequent urination, unexplained weight loss, fatigue or drowsiness, blurry vision, slow healing wounds, dry itchy skin, tingling or numbness in the hands or feet, frequent urinary tract infections, yeast infections, and darkening skin around the neck and in the armpits. If you have 1 or more of these symptoms, you may have diabetes. Your weight, diet, race, family history, and frequency of exercise are all risk factors for diabetes. If you had gestational diabetes during pregnancy or have polycystic ovarian syndrome, your risk is also increased. Diabetes can affect nearly every major organ system in your body. The complications of diabetes are vast. Diabetes can lead to cardiovascular disease, stroke, and cancer, and may damage the nerves, kidneys, eyes, and feet. The risk of cardiovascular disease triples in patients with diabetes. In addition, diabetes is the most common cause of end-stage renal disease in patients receiving dialysis. The good news is that with aggressive control of diabetes, your risk of complications from this chronic disease can be modified. Diabetes is diagnosed with a fasting blood sugar greater than 126 or with a hemoglobin A1C greater than 6.5. These are both blood tests. Early in the course of the disease, blood sugar can often be controlled with oral medications, but as the disease progresses, it may become necessary to replace these with insulin shots. If you have been diagnosed with diabetes, ask your doctor to check your hemoglobin A1C, which gives an average of your blood sugars over the past 3 months. Your doctor should monitor your kidney function with a urine test called a microalbumin, which may reveal that you have a diabetic nephropathy by detecting small amounts of protein being spilled by the kidneys. You should also visit your ophthalmologist annually for a dilated eye exam. Your doctor should examine your feet at each visit to identify peripheral neuropathy from nerve damage, as well as to check for any foot wounds that could lead to infection. We offer diabetes education to empower our patients to manage their diabetes with the help of their physician and dietitian. Ask your doctor what your blood sugar goals should be before and after meals. Ask your doctor what you should do if your blood sugar is too high or too low. Call your doctor if you develop confusion or dizziness, nausea or vomiting, increased thirst or frequent urination, if you start breathing faster than usual, feel weak or drowsy, or become confused, dizzy, or uncoordinated. In severe cases, you could develop diabetic ketoacidosis, which must be treated in the hospital. If left untreated, this condition could lead to coma and even death. Diabetes is a chronic lifelong disease, but the course of the disease is closely related to how well blood sugars are controlled on a daily basis. In addition, your doctor will treat high blood pressure and high cholesterol more aggressively, since having diabetes increases your risk of stroke and heart disease. Incorporating physical activity into your daily schedule and eating a healthy diet rich in fruits and vegetables, whole grain breads, lean meats, fiber, and restricting simple sugars and saturated fats are critical lifestyle changes that you can make. I hope that I've been able to help you better understand what diabetes is and how you can live life at your best.